You're watching Mirror 7 News. Stay informed, stay ahead for more news.
Since July, a chikungunya outbreak that began in Cuba's western province of Matanzas has rapidly spread across the entire island, overwhelming communities already struggling with a severe economic crisis. The virus, carried by mosquitoes, has infected tens of thousands of Cubans in just a few weeks, with health authorities reporting over 47,000 confirmed cases this week alone, a figure that has doubled compared to the previous week. Experts warn that these numbers only reflect patients who have sought medical care, meaning the real scale of the epidemic is likely far greater. In Havana's Jesus Maria neighborhood, residents describe the epidemic as inescapable. Pilar Alcantara, an 81-year-old who lives alone, shares that she has been bedridden for days, plagued by intense joint pain and fever. "I can't walk. My whole body hurts," she says, a sentiment echoed by neighbors who continue to suffer lingering symptoms weeks after falling ill. Eva Cristina Quiroga, 74, adds, "Here, everyone has been infected," as she waits outside her building where mosquito fumigations were carried out for the first time. Cuba's health authorities, led by epidemiologist Francisco Duran, have emphasized the gravity of the situation. The chikungunya virus has now reached all 15 provinces, alongside other arboviruses such as dengue, Zika, and oropouche. Around 30% of the population, roughly 3 million people, are estimated to have been affected by either chikungunya or dengue during this outbreak. 20 patients remain in critical condition, although no deaths have been officially reported. The epidemic has been worsened by the country's ongoing shortages of medicines, food, and electricity, making recovery for many patients slow and difficult. Fidela Freire, 61, explains that resting at home is the only option available, as essential medications are scarce and basic food items, like chicken, are unaffordable. The recent Hurricane Melissa has further strained resources, damaging more than 640 health centers in the western provinces, according to the United Nations. Unlike past outbreaks of dengue, chikungunya is relatively new to Cuba, first appearing in 2014 during a regional epidemic affecting neighboring countries. Early efforts then successfully contained the virus, but this time, the epidemic has spiraled out of control. Experts cite poor sanitation, accumulated waste, and stagnant water stored in household cisterns as key factors contributing to the virus's rapid spread. For many Cubans, life has been upended. Pedro Gonzalez, a 59-year-old driver, describes how the virus has left him with lasting leg pain, forcing him to work only when he can. As the country faces one of its worst economic crises in decades, with widespread emigration and declining productivity, the chikungunya outbreak adds another layer of urgency to an already fragile situation. In short, the epidemic has not only highlighted public health vulnerabilities, but also underscored the daily struggles of ordinary Cubans trying to survive amid disease, scarcity, and disaster. The rapid spread of chikungunya across the island serves as a stark reminder of how interconnected health, environment, and socioeconomic stability truly are. Stay subscribed for more videos.